ಮಾಧ್ಯಮ ಮತ್ತು ಸಾಮಾಜಿಕ ಜಾಲತಾಣಗಳಲ್ಲಿ ಮಂಗಳೂರಿನ ಫಾಸ್ಟ್ ನ್ಯೂರೋ ಆಸ್ಪತ್ರೆಯ ಬಗ್ಗೆ ಮತ್ತು ಕೋವಿಡ್-19 ಸೋಂಕಿನ ಬಗ್ಗೆ ತಾಳೆ ಹಾಕಿ ಅವಹೇಳನ ಮತ್ತು ತಪ್ಪು ಸಂದೇಶಗಳು ಬಿತ್ತರವಾಗ್ತಾ ಇವೆ. ಈ ಹಿನ್ನೆಲೆ ಕಳೆದ ಕೆಲ ದಿನಗಳಿಂದ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ನಡೆದ ವಿದ್ಯಮಾನಗಳ ಬಗ್ಗೆ ಫಾಸ್ಟ್ ನ್ಯೂರೋ ಆಸ್ಪತ್ರೆಯ ನ್ಯೂರೋ ಸರ್ಜನ್ ಡಾಕ್ಟರ್ ಸ್ಕಂದ ಮೂರ್ತಿ ಅವರು ಎಳೆಯಾಗಿ ವಿವರಿಸಿದ್ದಾರೆ. ಅದು ಏನು ಹೇಳಿದ್ದಾರೆ ನೋಡೋಣ.
Let me be very clear. I am not here to offend anyone who may have different opinion, or nor is this an encomium about our hospital. I just want to put forward things in front of you all as they happened. So this lady who was diagnosed with a corona infection and all that was admitted in our hospital for the treatment of stroke much before all these corona days started. It was, as far as I remember, it was I think even before 15th of March. She was admitted for the treatment of stroke. She was receiving treatment and then she was undergoing physiotherapy rehabilitation process and all that. So then slowly the corona fear built in, the number of cases increased and the lockdown happened. All these things were going on, and we had to take necessary measures so that we decrease or minimize the risk of infection. So our hospital administration had taken all the necessary measures that could have been practically taken. We decreased the number of visitors to the hospital. The ICU visiting hours, where we allowed 2 visitors previously, then we cut short it to 1 visitor. We requested all the patients and the relatives that the same patient attendant should remain from the day of admission till discharge, so that he doesn't go home, bring some other patient, and then thus increasing the risk of infection. We also stressed on the PPEs. If any of you have visited our hospital in the last 1 month, you might have seen that our hardworking security guards were standing in the sun in front of that gate, monitoring the entry of visitors, minimizing the entry of them, and also happily providing them the hand sanitizers. We also made necessary changes in the duty roster of our nursing staff and all the other staff, so that there was minimal cross infection. And then our hospital is a neuro hospital. We don't really treat corona patients as such, but there were a few so-called hotspots where there were higher number of cases. So we also had to make a strategy to treat those patients who are having neurological problem and hailing from those areas. So what we did was we converted our 3rd floor general ward into an isolation ward with a dedicated nursing staff provided with all the PPEs. The same thing was done even in the ICU. We have a so-called step-down ICU, which was converted into an isolation ICU. So if you see, we had taken all the measures that could have been possibly taken. So, and then we also postponed all our routine work, and we stressed on the emergency services so that the emergency services could go on without any hindrance. I'm not exaggerating it, but I can confidently say there were at least 15 to 20 such patients who came after 15th of March who required emergency neurological or neurosurgical intervention so that their lives could be saved. If they had not received their treatment, probably they would have lost their life, or would have lost their limb or eye or whatever. So if we had shut the hospital because of the fear of getting the corona infection and not treated those, probably those 15 to 20 patients would have succumbed and would have died because of neurological problem and not because of corona. So please understand, in providing this emergency service, we have risked our lives. We have, by we mean the doctors, the nursing staff, the technical staff, the receptionists, the cleaning staff, the canteen staff, everybody. We have taken that risk of getting the infection ourselves, and tried our best so that the emergency services could go on. Please tell me, do you really feel this is a mistake from our side? Do you think we should have just shut the hospital, not provided the necessary emergency care, and let those patients die of some other problem? Let me tell you, neuroemergency is something where we cannot send the swab and then wait for 2-3 days for the results to come and then take action. It all must happen within minutes to hours of the patient arriving the hospital. So we do not have time to send the swab, confirm that the patient is COVID negative, and then proceed. That is not possible in a neuro setup. Please understand that. And then it so happened that unfortunately there was death of one of the lady because of coronavirus infection in Wenlock Hospital, and it was later discovered that she was a daughter-in-law of the patient who was admitted in a hospital, whom I mentioned about much before the corona days, and she also had come to a hospital to visit her once or twice, whatever. So on realizing this, we shifted the patient to an isolation ward to call necessary measures, appointed a dedicated staff. But then probably by then she had spread the infection to a few. Then later she was shifted to Wenlock Hospital, her swab came positive, and all these things are known to all of you. All these things are out in the media. So do you really think there was any blunder from our part, in any of this? Do you think we should have just stopped all the emergency services? Just imagine what would happen if all the hospitals decide to do so. They just decide to shut their emergency services. Where would you go for the treatment of non-COVID conditions? And it is the harsh reality currently that all the doctors in Mangalore, they are scared. The doctors and the hospitals are scared to treat any patient for that matter, because that patient may later turn positive or their relative may be positive, and then because of that the entire hospital may have to be shut down. So they're all scared to treat even heart block, malaria, asthma, whatever it is. So that is the harsh reality right now, and that is definitely not a good sign. And I would say there will be a lot of collateral damage, a lot of people losing their lives because of non-COVID condition, just because of this fear that is associated with the people and this blame game, shaming others, spreading rumors. Because of all these things, please refrain from doing these things, because these things will take us nowhere. We will all doom together if such things continue. At the same time, we are extremely sad about the newly diagnosed corona patients. There was a patient and her son who got diagnosed yesterday, and our beloved Akka who also contracted the disease from that lady. We are really praying for their recovery, and we hope they come out in a healthy condition. But we are also glad and relieved that all the other samples, which was as above 190, I guess, have been tested negative. We have not got the report, but that is what is told to us, that the rest of the samples are negative. So we are glad that the other samples are negative, and of course that goes to show that it is not because of negligence from the part of the administration. We had taken all the necessary precautions. So people, please understand, these fear-mongering, blame game, spreading rumors is not serving the purpose currently. This will only make the situation worse. We need all your support as we fight this battle. We want all of you to be with us. By us, I mean not just our hospital. It is all the healthcare workers, all the hospitals. We need your support. We need you to all to stand in solidarity and support us, because it is not possible to fight this battle without your support. So I'm really begging you, please refrain from spreading rumors and creating sort of panicky environment that will not help in serving any purpose.